Wilson disease. The detail of Wilson disease we will discuss in the hepatic system. Now, shortly we will discuss the Wilson disease because there is neurological symptoms also. Now we will discuss the Wilson disease. The Wilson disease in the neurology also called neuro-Wilson disease. Wilson disease or neuro-Wilson disease. The Wilson disease is the autosomal recessive disorder of the copper metabolism. This is the autosomal recessive disorder. That is genetic cause. This is the autosomal recessive disorder of the copper metabolism. Copper metabolism. The Wilson disease is associated with the neurological dysfunction, neurologic and psychiatric dysfunction and liver dysfunction. We will discuss the Wilson disease, a short review because there is neurological dysfunction, and we will discuss the detail of Wilson disease in the hepatic system. So the Wilson disease is the autosomal recessive disorder. It is autosomal recessive disorder. It is genetic disease. It is autosomal recessive disorder that cause mutation in the ATP7B gene. Mutation in ATP 7B gene. ATP7B gene. The ATP7B gene encoded P-type, it appears. This ATP7B gene encoded P-type, it appears. P-type, it appears. The mutation occur in 1 in 30,000 patients. 30,000 patients. 1 in 30,000 patients. The ATP7B gene mutation occur, and this is the autosomal recessive disorder. That is Wilson disease. Half of the Wilson disease manifests as liver dysfunction, especially in young. Half of the Wilson disease manifests as liver dysfunction. Half of Wilson disease manifests as liver dysfunction. Liver dysfunction. In half of cases of the Wilson disease, there is liver dysfunction. The liver dysfunction are especially present in young adults. There is liver dysfunction. The remember half of the cases of the Wilson disease, there is neurological disorder. There is neurological disorder, and there is also psychotic disorders. They may be associated with liver disease, or without liver disease. But half of cases of the Wilson disease, there must be the liver disease, especially in the young adults or young children, adulthood. Small group have psychiatric disorders. The Wilson disease, there is neurological dysfunction and psychiatric dysfunction. Psychiatric dysfunction. So there are 3 dysfunctions in the Wilson disease. Number first is the neurologic. Second is the liver dysfunction, and number third is the psychiatric dysfunction. Half of the cases has the liver dysfunction, especially young, and the remember half is neurological dysfunction, and in small groups Small groups has psychiatric dysfunction. Now we will discuss the neurological dysfunction. The neurological dysfunction. Neurological dysfunction. What is the neurological dysfunction in the Wilson disease? The neurological dysfunction include tremor, rigidity, dystonia. The tremor in the initial stages, they occur in the upper extremities. In the initial cases, they occur in the upper extremities. They may be bilateral or asymmetrical. It is at one side. In advanced cases, in the advanced cases of the Wilson disease, there is wing beating appearance. Advanced cases, there is wing beating appearance. The wing beating appearance is called the characteristic of the neurological dysfunction of the Wilson disease. But this is in the advanced stage. That is wing beating appearance. That is the patient has outstretched hands with finger forwards. For example, the other symptoms of the Wilson disease is that is tremor. Tremor may be in the upper extremity, may be bilateral, asymmetrical, and in the advanced stages there is wing beating appearance. This is the characteristic of the neurological symptoms. That is wing beating appearance. So the tremor may be intentional tremor. The other neurological symptoms may be Parkinson disease. Other neurological symptom may be Parkinson disease. The Parkinson disease symptoms in the Wilson disease is bradykinesia, dystonia, dysarthria, and dysphagia. More than half of the neurological diseases has psychiatric problem. Half of the neurological disorders, that is 50%, has in the neurological disorder. In case of the neurological disorder, the 50% patient has psychiatric problem. The psychiatric problem may be depression, mood swing, and psychosis.